Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to get to talk to Miley, our medical liaison in pharmacogenomics, but really excited to hear what she says about pharmacogenomics. So how do providers choose, so this is more like maybe current state of affairs, how do providers choose a drug for a patient? What's the current standard practice?
That's actually also a very big question. Yeah, I'm just gonna try to keep it as short and sweet as possible. As healthcare provider, when we choose a drug for the patient, first we have to consider the patient medical history. So this includes like existing health conditions. What is the patient's currently taking for the medications? Do they have any allergies? Did they have any previous medication response that really notable? Or they have any adverse reaction? I know adverse reaction is kind of like something really common if you're currently taking any medication. Any medication has adverse reaction, but if it's too severe or if it's too weirdly consistent, like unexplainable is a really important thing to consider too. Another thing that we use is clinical guidelines. So we always consulting evidence-based guidelines that recommend the most effective treatment for specific conditions, and also having updates from the clinical guidelines to see if there's any new or like better way to treat our patients. And then we will evaluate the effectiveness and safety profile of the medication in relation to the patient conditions that we reviewed. I think another thing that we can integrate into how we can choose a good treatment for the patient is pharmacogenomic information, like I mentioned above. So the genetic test can provide valuable insights into how a patient metabolized certain drugs. So variation in genes, such as the in cytochrome P450 family, can significantly affect the drug metabolism, leading to differences in drug efficacy and the likelihood of adverse reaction. So if we have the result, we can classify the patient as poor, intermediate, extensive, or ultra-rapid metabolizer based on the genetic profile. For example, if the patient is a poor metabolizer, they may require a lower dose of the medication to avoid toxicity, to example. So from all of the important information that we have from the patient, we will create a very tailored treatment for the patient by utilizing pharmacogenomic with other basic information that we always have in hand when in our mind when we consider treatment for our patient. And I believe that this integration will lead to a better outcomes as the patient are more likely to receive the medication that work effectively for their unique genetic makeup.
Great, thanks. So it sounds like pharmacists already work very hard to personalize medications as much as possible, and pharmacogenomics is really a way to extend that and make it better, quicker, more efficacious for everyone involved. So thank you, Miley. Appreciate that.